Chairman, Committee on Hematology and Blood Transfusion, NMA, Lagos, Dr. Bodunrin Oshikomaya is in the studio. I also have hemophilia survivor Sanusi Akim Omobolaji in the studio as well. Good morning. Good morning. Thank you for joining us on TVC
Good
Breakfast.
Yes. Good morning.
Right, I'll begin with you, Akim. Talk to us your experience with hemophilia. Share your experience with us.
All right, ma. Good morning. Thank you so much, ma. Yeah, I think I'll start with my childhood experience of hemophilia. Virtually, I didn't know much about it, but one of the experience my mom told me was when I was 6 months, and I was asked to rush to the hospital. I had a challenge and stuff like that, and I was dead already in her hand until the doctor came in at exactly 12 a.m. That is 1st of January, the other year, the following year. And she put me in her hand, and then she tried all she could to bring me back to life. And then I was told I was transfused. And then the transfusion went wide, and they had to go through a corrective measure to bring me back to normal.
Life, yeah.
And then, most like every other children with normal lifestyle, like we also have to live our life even with hemophilia. The pains usually used to be very serious one and a very severe one, that even at the time, I don't know.
Where do you have these pains?
Yeah, it used to come up, and the joints, especially when I have a bleed into the joints, both minor and then the major joint. But my most target joint when I was growing up was my right nail, which is my most targeted joint, of which it has been damaged presently due to the cause of the pains. The pains is usually much. I can as well just relate this. There have not been anybody who loves his enemy. But as much as hemophilia pains is concerned,
you do not wish it on your enemy?
Yes, you do not wish your enemy should be going through such.
It. Right.
So the pains is usually much to an extent that you'll be begging that God should take your life. And that is how the pains used to be. There are times when I have pain. Let's say I'm bleeding into my right knee now, and my right elbow now. The only thing that will be coming into my head is that the hand should be cut away. Because all I'm just thinking about is just a solution to be better, to be relieved. That is how terrible the pains can be. And then most likely, hemophilia pains can push you to a stage whereby you'll be asking help from your enemy. Everybody that is rendering a help becomes your friend. I can remember one major experience I had that time. When hemophilia pains came up, occurs like this, it stops my activities going to school.
Right.
There are times I have to be at home for 2 months, not going to school at all. And there are times I will have to go to just go and write the examination and just pass. But thank God that has helped me so far academically. I know I wasn't a dullard, and then stuff like that.
All right.
So I was about sharing an experience the other time of a day when I couldn't go to school. That was when I was in primary school. I live in a face me and face you apartment where we have up to like 15
people.
Rooms.
Yeah.
I mean rooms.
Rooms. Oh.
In the house. So, and growing up in a room, just one room apartment with my siblings, 5 of us. My elder brother is also hemophilic. And staying in a room, 5 of us with other siblings, my mom and my parents and other relatives, it's how it could be.
Yes,
so I couldn't go to school that
imagine.
day. So I was at home, and then the pains were so much. And when this pains comes up like this, I can be crying because I used to be a stubborn boy when I was growing up. So everybody knows me. Don't play football, I will play. These are precautions that you have to take when you are hemophilic. I will go out there. I want to behave like every other person. So that day, I was having pains on my left elbow. So I was crying in the house. I couldn't go to school. That was when I was in primary school. So there is this woman in our house known as Auntie Ngozi then. So she came in. She saw me crying in pains and agony. So she couldn't bear it. So she went in to take a sleeping tablet. So she cut the sleeping tablet into 2. So she gave me half that I should take it. So when taking the tablet, I felt relieved a bit. So I think what happened was that I dozed off. So after some minutes, I woke up. So I was like, oh, wow, this pain, this drug works magically. So what did I do? And I took the second part of it. And she warned me not to take it. So I took the second part of it. So after taking it, the rest is history. My mom told me the experience that everybody that was coming in that day, I was calling them to be my friend, Balagari Peter. Then those are the people I grew up, the likes of Wale Akwankwa.
Obviously, there's so much you have that you can share with us, but it is good to see that a lot of persons need to understand what this is about and what should be done and what is not to be done. But we need to quickly move over now to Dr. Boduri to talk to us, because he mentioned something that is like there was not much information, or there is not much information out there with regards to hemophilia. His mom was not aware what was going on stemming from what he said. And when you look at reports, it is reported that a significant number of people living with hemophilia and other bleeding disorder are reported to be either underdiagnosed or not even diagnosed at all. And we're wondering, this issue has been on, this day is being commemorated since the 1980s, yet not much information is going out there. What are we not doing right with regards to talking about this?
Well, the first is that we're not even talking enough about it. First of all, hemophilia is a rare genetic disorder. It's not very common. The World Hemophilia Foundation estimates that 1 out of every 5,000 male births is hemophilic. So it is not a very common condition, but that doesn't mean it doesn't happen. It's quite a number of people are hemophilic around. So we're not even talking about it enough. If we talk about it enough, if we have more advocacies, more conferences, more training on the care of hemophilics, then we can say that more people will know about it. With respect to the commemoration of World Hemophilia Day, not everybody also does it. It's unlike when you're commemorating World Sickle Cell Day, when we're commemorating other health days like World Hepatitis Days. More publicity needs to be given to the hemophiliacs. I am sure that not many people have come in contact with people like Sanusi Akin.
Absolutely, yeah.
Yes, I am sure that more than 50% of the people that are on this program now have never heard about hemophilia, talk less of.
So by way of educating people, what should they look out for as symptoms to understand that perhaps this is hemophilia?
Well, the first thing, it depends on the timing we are diagnosing it. So if at birth, a child, maybe if there's a difficult birth and you have a child that has bled into the skin of the head, which comes in regularly, you should begin to think about it. If you have post-circumcision bleeding, which is the most common of it around, you should think about it. But before I continue with the symptoms, we need to understand that hemophilia is a condition that is common in males. Because the genetic mutation is carried by the X chromosome. So the males have just one X chromosome and one Y chromosome.
So it's rarely found in females?
Females are carriers.
Right.
And before you find it in a female, that means the father and the mother must both have a mutated X chromosome. So if you have a male child circumcised and is bleeding uncontrollably, I should investigate for a bleeding disorder. As the child is growing up, especially when the child starts to crawl, when the child is about to walk, during this period, the child keeps falling down. By the time the child starts having things like bleeding into the joints, pains, then we should begin to investigate for a bleeding disorder. Also, as the child, as you was talking about playing,
yes,
we did football, contact sports. When we grow up, we want to play football, especially the males. They want to take part in activities like wrestling amongst themselves. So when they do these sports, they will always come up with bleeds, most especially in joints. That's why I said target joints. Yeah. It's usually a susceptible joint that bleeds more than the others. So they will continue to bleed like that. And then we have cases of people that bleed into the brain, severe people that fall bleed into the brain. Internal bleeding is common. I've seen an hemophiliac that bleeds into the GI. It's because he's a known ulcer patient. So anytime he has his ulcer crisis, it will bleed internally. So it just bleeds anywhere, common in the joints, especially at adulthood.
Do they do they outgrow this condition?
The truth is that hemophilia has no cure, but the presentation varies. There is no cure, but the presentation varies. So somebody can come with mild symptoms. Mild symptoms, maybe it is stimulated by an activity or maybe a stressful thing or maybe a fall, and then some just come spontaneous. That's severe cases. They are doing nothing, the bleed just comes in. So they really don't outgrow it per se. But with someone like Sanusi, when he was growing up, he told me that he used to have his bleeds like every 2 months, but now it's not as common as that. It could be of two things. Right now he's growing older, he understands the things he should do and the things he should not do. So you don't outgrow hemophilia, there is no cure for it.
Really? Yeah. So let's look at perhaps how life-threatening this is, still staying with you, especially when we have reports of it being underdiagnosed or not even diagnosed at all. How life-threatening for someone who perhaps did not understand that this is what is going on to have discovered that it is hemophilia.
Well, if you have severe symptoms, then you could die from the bleeding. Because the bleeding just keeps coming, especially if there is no treatment for that bleeding at that time. So, as I said before, it depends on the presentation. It is life-threatening if you have severe bleeds. If there is an accident, and some people come, actually they didn't know they were hemophilics. They have severe accidents and they just keep bleeding. And the doctors are there struggling to make sure that they stop the bleed. You know, it could be that. So it could be life-threatening, depending on the presentation at that time.
Right, let me come to you now, Akim. Seeing that perhaps you already know what not to engage in terms of activity, are there foods perhaps, talking about diet now, that you avoid, or there are things that you need to take consistently to ensure that you are as stable as possible and you don't have as much bleeding?
Yeah, talking regards to the diet, specifically I was told to be taking more of protein and vitamin food, which could actually aid well on that. So there is no specific food actually, but I was told to feed on protein and vitamin food more.
All right. Now talk to us again about support, the support you got from family and how that has helped you thus far.
From
family, friends?
Okay.
You know.
Yeah, well, I would say when I was growing up, the support was not that much because I have to go through stigmatization where people don't want to get to play with you. Even children, the parent will tell their children not to play with you because if you touch him now, that place will be stolen. So people run away from you, schools, teachers don't want to always. But my parents and my siblings are wonderful enough, and then they were. But at the time, my friends got to understand these stuff, even if they don't know what hemophilia means as of that time. Me, I don't even know what it means also too. But I shall know that this is what I'm going to. Once I hit my leg or probably my joint at any place, that place becomes swollen and it becomes very painful. So my friends, they gather around me after some times of getting to understand this. It has been wonderful. My parents tried, my friends, and even on campus, while I was in school on campus, my secondary school days, I have the likes of Said Awelenje, Ruben Osigbeme, friends who are always there for me. And then on campus also too, I have friends who are also always there for me and stuff like that. So far, so I have people. But one thing that has actually helped me so far was the fact that I was able to relate the issue with people after some time, because I don't like talking about hemophilia before, because I felt like I'm a strange person. I felt like and it affected me a lot. Inferiority complex and stuff like that started flooding in and stuff. So even in my work, in my assignment in school, after finishing them, I don't easily accept them as my own, because that side of pains and not being accepted by people, especially when you are working. There's one thing I don't do. I don't like working in the front of a full mirror.
All right.
Because of so that
also came in. Okay.
Yes.
Now he mentioned something, stigmatization. I asked the coping mechanisms, how people can cope at a period such as this, especially with the pandemic, how they can adapt to change, which is the focus for this year, and how to also deal with stigma and perhaps the support system that they need at a time such as this.
Yes, with respect to stigmatization, the more we let people know about the condition, the easier for the incidence of stigmatization to reduce. So, especially in a community and environment like ours, what you do not understand becomes fetish. It becomes traditional. So, if there is no explanation to it, it is easy for people to run away from him. So the more we talk about it, the more we do things like this on here, on social media, the more it talks about it. It's very nice. Also, when it comes to hemophilia, we have groups, hemophilia groups, and that is the best coping mechanism that we have here. Because if you have somebody to talk to, if you have somebody that understands you, then it's easy for you to cope with that period. We're talking about pain. The pain is unimaginable. Even when you hit your knee against a hard surface, I can imagine the pain you feel.
Yes.
Talk us of when the pain continues to increase, because the more the bleed, the more the pain you will feel in that particular joint. Understand? So it's only somebody that has experienced that type of pain. So there are lots of, we have the Hemophilia Foundation of Nigeria. They have been wonderful. They have been in for a while. It was first started by an hemophilic mother of 3 sons. All hemophilics, and she has been able to work with Hemophilia Federation of Nigeria. Through them, we've had support in Nigeria with respect to drugs, with respect to incentives for them to be able to cope. So many other support comes in. It's just that this is not enough.
And if we're talking about support and everything that you have mentioned, let's look at treatment. What kind of treatment these persons get? And if we need to improve in certain areas, what are the areas you think there should be some level of improvement moving forward?
So the only treatment for hemophilia is a replacement treatment. You need to replace what is lost or what is not available. So you understand that the problem is there is a bleed because we don't have adequate clotting factors. So the treatment is to replace that clotting factor that is absent. So we can get clotting factors from 2 ways. First of all, we can get it from the blood in form of cryoprecipitate or fresh frozen plasma. And you can get it from synthetically developed drugs. They are all infusions. We try to discourage multiple transfusions of blood-borne clotting factors because it exposes the hemophilia to diseases, to antibodies, to inhibitors that can prevent them to clot further. So the best one is to have the drugs. They're like injections. They're expensive. They're unable to afford it. So if we do not have those drugs given to them free of charge or subsidized, then it becomes difficult for them to live a normal life. Because the longer you delay the treatment of hemophilia, the easier there will be damage in those affected areas. So talking about what more can we do, we need to have an hemophilia treatment center. There is a hemophilia treatment center around. We have
Nigeria as a whole?
Well, in Lagos State, I don't know of Nigeria, but right here in Lagos, we don't have a specified based hemophilia treatment center. So we have sickle cell treatment centers, we have stroke centers, but we need to have a center just for hemophiliac. However, LUT has been doing a lot of work with respect to it, because that is where the Hemophilia Federation of Nigeria started off from. They train a lot of people in LUT, but we need to have a facility for them. We need to have a place where they can have a gym, where they can have consultants, where they can have orthopedic surgeons there, where they can have their drugs at pharmacies, where they can have counselors, where they can have psychiatrists, psychologists there. It has to be a full place with everything they need there. So we need to have such a facility for them to be able to live a normal life.
Absolutely. So your final word, Akeem, just very short because we have very limited time on a day like this. How would you expect or how would you want it to be commemorated, talking about tomorrow?
Okay. Tomorrow is the World Hemophilia Day, And then, you know, one of the major thing about it is that we actually want people to get to know about hemophilia, and then we actually want the government also to assist, just like what doctor have said, understand, in terms of getting some of these drugs available for us. So, and a lot of program has been put in place to get people educated. So I would encourage people to join. There are a lot of these handles on our social media, so that they can
perhaps
get
you would
to
mention them so that people can know where to jump quickly.
Oh, I don't actually have them,
All right.
but they are on
They can
social
search
media.
for it.
But they can go to www.hemocare.com. That is the official website for the Hemophilia Foundation of Nigeria.
All right. Your final word, doctor?
Well, I want all healthcare personnel, nurses, school administrators, especially in primary schools, to actually take a little bit more time to learn a bit about hemophiliacs. And I know that care starts from them because at childhood, they see a lot of them. I also want to tell everybody not to stigmatize them. It's a painful thing on its own. Please love us, be kind to us. I would be grateful for it.
All right. Chairman Committee of Hematology and Blood Transfusion, NMA Lagos, Dr. Bodurin Oshikomaya, as well as hemophilia survivor, Sanusi Akim Omobolaji. Thank you for joining us on TVC Breakfast.
Thank you for having us here.